We welcome you to the International Herbal Medicine Centre, England. This episode is titled Menstrual Disorder. A menstrual disorder, also known as a menstrual irregularity or menstrual dysfunction, refers to any abnormal change in the regular menstrual cycle of a person with a uterus. The menstrual cycle is a natural process that involves the monthly release of an egg from the ovaries and the shedding of the uterine lining, leading to menstruation or a period. Disorder associated with the menstrual cycle are among the most prevalent female health problems. They include heavy bleeding, menorrhagia, amenorrhea, no bleeding, fibroids, non-cancerous uterine tumors, dysmenorrhea, painful menstrual period, and premenstrual syndrome, PMS. Can you please click and subscribe to our YouTube channel? We need your support to keep this educative channel alive. Oligomenorrhea. This refers to infrequent or irregular menstrual cycles. Endometriosis. This condition occurs when tissue similar to the lining of the uterus grows outside of the uterus. Premature ovarian insufficiency, POI, also known as early menopause, POI is when the ovaries stop functioning before the age of 40, leading to irregular or absent periods. Some women experience a host of physical and/or emotional symptoms just before and during menstruation. From heavy bleeding and missed periods to unmanageable mood swings, decreased energy, tension, irritability, depression, headache, breast tenderness, bloating, and water retention. Menstrual disorders are brought on by lifestyle factors such as poor diet, stress, depression, lack of exercise or excessive exercise, obesity and extreme weight. In a study, women were asked to list up to 3 treatments they had tried and found most effective for treating PSM. Mention was made of taking nutritional supplements, getting more exercise and making dietary changes. Sleep consistent hours and get enough sleep. Most people need 7 to 9 hours. Studies show that hormones get out of control when you don't sleep enough or sleep well. You may have different sleep requirements during your menstrual cycle. Exercising for at least 20 minutes 3 times a week can reduce the pain associated with menstrual cramps. Walking, cycling, swimming and aerobics can be of tremendous relief. These are necessary diet habits. Eat a carbohydrate diet. Eating fewer animal proteins decreases the amount of saturated fat in your body. This can help reduce PMS symptoms by reducing circulating estrogen levels and by removing sources of outside estrogen. Avoid alcohol, caffeine and sugar. Alcohol is toxic to the liver. The liver is responsible for the breakdown of estrogen so that it can be excreted. Alcohol can increase the levels of estrogen, thus increasing pelvic congestion. Sugar causes constriction of blood vessels, which can worsen cramps. Take juice vegetable. Women who juice regularly and eat lots of raw foods can often report that menstrual problems diminish or disappear on this diet. Use juice fasting and liver cleansing to help eliminate bloating and other menstrual difficulties. Herb advice. Black cohosh is a relaxant and normalizer of the female reproductive system. It is helpful for painful or delayed menstruation. Black haw bark relaxes the uterus. Highly recommended by some people. Cramp bark relaxes the uterus and painful cramps associated with menstruation. Motherwort stimulates delay-suppressed menstruation, especially if anxiety or tension is involved. The treatment for menstrual disorders depends on the specific type of disorder and its underlying causes. It's important to note that while some menstrual disorders can be managed effectively, others might not have a complete cure, but can be managed to improve symptoms and quality of life. It's important for individuals who suspect they have a menstrual disorder to seek medical advice. A healthcare provider can diagnose the specific disorder and recommend appropriate treatments, which may include lifestyle changes, medications, hormonal therapies, or, in some cases, surgical interventions. Open conversations about menstrual health and disorders are crucial in reducing stigma and increasing awareness, leading to better understanding and support for those affected. Please remember to click and subscribe to our channel.